71 million American seniors are learning what their so-called cost of living adjustment really means, and it's not what the Social Security Administration promised. Wait, because here's what they're not telling you. The government announced a 2.8% COLA increase back in October. That's $56 more per month for the average retired. And they made it sound like relief was coming. But while you were celebrating that tiny bump, the Centers for Medicare and Medicaid Services quietly jacked up Medicare Part B premiums by 9.7% from $185 to $202.90 per month. Do the math. That $17.90 increase eats nearly 1/3 of your COLA before the money even touches your bank account, leaving you with $38. $38 to cover 12 months of inflation on groceries, utilities, prescription drugs, and everything else that's gotten more expensive since last year. Financial expert Suze Orman is sounding the alarm, warning retirees that this isn't just bad luck. It's a structural trap. The COLA is calculated using consumer price data from the third quarter of 2025, which means it's always lagging behind actual cost you're paying right now in 2026. By the time the adjustment kicks in, inflation has already moved past it. Meanwhile, Medicare premiums are rising nearly 4 times faster than your benefits, and they're deducted automatically from your Social Security check whether you can afford it or not. This is the system working exactly as designed. Not for you, but against you. For retirees earning above $109,000 as individuals or $218,000 as married couples filing jointly. The situation is even worse thanks to income-related monthly adjustment amounts known as IRMA surcharges. These higher-income seniors, and we're not talking about billionaires, we're talking about people who saved responsibly and now have modest retirement accounts or pensions, are paying up to $689 per month for Medicare Part B alone. That's triple the standard premium, and it went up 9% this year while their COLA went up less than 3%. Who designed this? In an AARP survey conducted last September, 77% of older adults said a 3% COLA wouldn't be enough to keep up with rising prices. They got 2.8% instead, and then lost nearly 1/3 of it to Medicare. This isn't incompetence. This is policy. The Social Security Act ties COLA to a specific inflation metric, the Consumer Price Index for urban wage earners and clerical workers, which doesn't even measure what seniors actually buy. It tracks the spending of working-age people, not retirees who spend more on health care and less on child care or working youths. Congress knows this. The Social Security Administration knows this. They've known it for decades, and they've done nothing to fix it because fixing it would mean spending more money on you, and that's not a priority. The average COLA since 2000 has been 2.6% per year. Sounds reasonable until you realize Medicare Part B premiums have increased by an average of 5.7% annually over the same period. Your benefits are rising at less than half the rate of your healthcare costs, which means every single year you lose ground. What happens when you can't afford the premiums? You lose coverage. What happens when you can't afford the deductibles and co-pays even with Medicare? You skip doctor visits, you ration medication, you delay treatment until a manageable problem becomes a crisis. And when that crisis hits, who pays? You do with money you don't have, while the government pats itself on the back for giving you a 2.8% raise. This is happening right now. In February 2026 to American retirees from Florida, Maine, from Texas to Washington State. This is not a future problem. This is not a warning. This is your reality today, and it will be your reality next year and the year after unless something changes. The question is not whether the system is broken. The question is whether we're going to demand they fix it or whether we're going to keep accepting crumbs while they call it compassion. Every time they announce a COLA, they're counting on you to hear the percentage and feel grateful. They're counting on you not to notice that Medicare took it back before you saw it. They're counting on you to stay quiet. Are you going to prove them right? Because if 71 million American seniors decided they'd had enough, Washington would have no choice but to listen.